One of the first questions was about the relationship between sugar and bladder cancer. And I noticed Eugene smirked a little bit because he actually led a study that my team helped him with, where we were looking at carbohydrate restriction in patients that had pre-diabetes, so they're at higher risk for developing diabetes, or they had diabetes. And the reason that we did that work is there is some suggestion that patients with diabetes are at higher risk of bladder cancer incidence. And the prevailing thought right now in the scientific community is that it may not be the sugar, but it may be the insulin that follows. So when we eat things that contain sugar in them, any carbohydrate, then insulin will go up. And that is our body's way of telling us that we have nutrition and we can grow. And so when we have cancer, sometimes there's extra insulin receptors that are on the tissues that are cancerous. And so they become more sensitive to consuming higher insulin levels and consuming sugars. And so that's one of the reasons that we were looking at just, again, not avoiding sugar, not avoiding all carbohydrates, but trying to keep insulin levels in normal ranges so, so that we're not leading to more building materials for the cancer to grow and progress. So, so that's that first question.
So I also had another question too that had come in. You know, I drink 3 to 4 cups of green tea with 1 packet of stevia per day. Is stevia safe to use if you're supposed to stay away from sugar?
Okay. Do you want me to take that one now or go back and order
Yes,
with the
please.
chat box? Okay. Yeah, so stevia is not as well researched as some of the other artificial sweeteners. And when we talk in kind of generally, a lot of times we group artificial sweeteners together, but they're actually very different compounds. And so I wouldn't say that there's anything to suggest that it's dangerous to have stevia. And the green tea sounds excellent. There's some suggestion that excessive green tea consumption can be hard on the liver, but that doesn't sound excessive. But when you go for your annual physicals, you know, just check out those liver enzymes, see if they're doing okay. And it sounds like a great habit, a way to stay hydrated, and yeah, and like a good idea. So I'm going to go back up. There was a question about interstitial cystitis after chemo, and that's a tricky one. I mean, there are some bothersome foods that are known to be bothersome for interstitial cystitis. So, you know, things like coffee, artificial sweeteners, spicy hot peppers, that type of thing. And this particular person really was curious, you know, am I going to have to follow this for the rest of my life? And my answer to that is results will vary. It's very individualized. It is usually something that will resolve over time. And when we work with people to help figure out what their triggers are, because it can vary from person to person, a lot of times what we'll do is a food elimination diet and really kind of dial in more on those bothersome foods to make sure that you avoid those, and that way you don't have those symptoms.
Yeah, Eugene, could you just give a very brief, really high-level, quick explanation of what interstitial cystitis is for the listeners, and then also maybe tell us how often does that happen?
Yeah, so interstitial cystitis, you know, to be honest with you, a lot of times doesn't, you know, we don't really see that interaction with bladder cancer that often. Usually interstitial cystitis is really bladder pain syndrome. Essentially, when people have pain that is attributed to their bladders, and it's really a diagnosis of exclusion. So it's not an infection, you've looked in there, there's no tumor or cancer, and it's really thought to be an inflammatory condition. There's a lot of different treatments, oral, intravesical treatments, so inside of the bladder treatments, And so it's kind of a lot of times a separate entity, but it really, as Jill said, is a lot of it is based on diet and what you are eating. So that is what I would say about that.
Yeah, actually, I think that the next question, Eugene, is really more yours too. It's about differences in complications or readmissions when you separate it out by robotic versus open radical cystectomy.
So the short answer is depends on who you ask. You know, it depends on if you're a robotic surgeon or an open surgeon. I say that jokingly. There have actually been several randomized control trials now comparing between robotic and open radical cystectomies. And the bottom line is that there really is no major differences in complication rates. And there's really no major differences in, sorry, my kids just ran in the door. So I knew that was going to happen at some point in time. But the bottom line is that really in terms of blood loss, there is a difference, but that's really about it. Most of the randomized trials have shown that there's no difference.
Great.
So is there a difference? I'm going to do a follow-up question just from my perspective, just to kind of expand on that idea. Is there a difference? Do you see a difference if people are physically fit prior to whether they go to robotics or open? Or is there, any kind of a difference that you see with people that are not physically fit? You mentioned obesity earlier as an issue. Is there any kind of recovery that you can talk about that has to do with nutrition or exercise, things along those lines?
I guess that question is, so yes, from a nutritional standpoint, obviously we want everybody to be nutritionally maximized. I would say from the standpoint of robotic versus open, I'm not sure it really makes a difference. I will say that the morbidly obese patient is difficult no matter what. Some would argue that it's a little bit easier to do a robotic cystectomy on someone who's morbidly obese, but I don't really think that that's kind of within the realm of, I think it's the comfort level of the surgeon.
Okay. I was just curious, since we were talking nutrition and fitness, if we just kept that theme going for a little bit. Okay, thank you. You want to do the next question, Jill?
Sure. So this patient knew about Dr. Lamb's work. He had studied a higher dose multivitamin that had some B vitamins, C vitamin, a little bit of extra folic acid, zinc, and essentially as a trial, I think he published in the 90s, he found lower recurrence rates in patients that had been treated with BCG. And so the vitamin supplementation is still available. I will say from the nutrition lens, the use of multivitamins for preventing cancer really hasn't panned out in larger studies in other cancer types. And I'm not saying that this is a bad idea by any means. I'm speaking more generally that we really think about the patterns of foods and the different components of foods working together to prevent cancer rather than really dosing somebody up with high dose vitamins. I think that our patient population has changed since then. So I think that the amount of people that come with micronutrient deficiencies to us are probably fewer than back then. And so as far as the effectiveness for today, I think focusing on eating a healthy diet first would be the first recommendation. And then if you feel like you might be a little bit low in B vitamins, thinking about bone health, I think that's really important after cystectomy. So we talk about that in the videos. So making sure that you're getting enough vitamin D, that's one of those components. And I think that is really important, as well as B12, which will be absorbed just a little bit less efficiently after a cystectomy. I think that is also a really important one if you're thinking about specific vitamins and minerals. Do you have specific questions for me, Stephanie, on that one? before I move
Nope,
on?
I think that was pretty good, because I know a lot of people have heard about that and they want to know, well, what can I do? What can I take? And especially family members, I think, really are motivated. They want to do something to help their loved one who's going through cancer, and providing food is one way that most cultures do that. And nutrition and looking at vitamins and supplements are all things that people are susceptible to in advertising, but also, you know, reading about it on the internet. You know, Dr. Google says if you take this vitamin, you're going to be cured. So that's really a challenge for a lot of people. So thank you for expounding on that a little bit.
Yeah, absolutely.
Want to move on to the next question?
Sure.
This is a good question, Jill, because you have such a phenomenal program there at KU, and here's somebody being seen in Boston, and they said that they don't think that bladder cancer nutrition is involved in the treatment at all. For years, they've been guessing at what to eat for non-muscle invasive bladder cancer. Being seen in Boston, not once in 6 years has nutrition been discussed. Why not?
Yeah, so I think this question actually reveals a chasm that we see in cancer care. So for some reason, because of the way that medical oncologists are trained, there seems to be a tighter relationship with the nutrition services with medical oncologists, and also with surgical oncologists. But urologists have a slightly different training path, and so for some reason in some academic centers, we're running a multi-site trial right now, so I'm getting a little bit more insight into how different academic centers communicate. The urology program and the nutrition programs haven't necessarily found each other. And so what I would suggest, a lot of times in healthcare, being your own advocate, or if you're a caregiver for your patient, also being an advocate and asking to see nutrition services is a great way to start that dialogue. And likely your physician will honor that. There is likely a nutrition program there, and people that have expertise in nutrition and cancer, but it's a matter of asking for it, because apparently the system isn't set up for automating that kind of referral. And my lab group and Dr. Lee and I have written actually several review papers about this to help change the culture of the profession as far as thinking about screening for nutrition issues, assessing, diagnosing, and intervening. So thank you for that. That's like so apropos. We're actually working on a paper. We have 2 that just published this year. We have 1 more right now that we're working on to, again, just advocate for patients that this should be automated, and therefore it wouldn't be, the onus wouldn't be on you to ask. But right now, know that you can ask, and then that service is probably there for you.
Great. So again, if you don't ask, you're not going to get anything. And if you do ask, you may have to really hunt it down, I think, is the major response, because it's not necessarily just standard protocol at every institution. Let's go to a specific question now. Is there a correlation between eating raw broccoli each day as opposed to no broccoli and reducing the bladder cancer recurrence in non-muscle invasive with high grade?
Yeah, so there is some evidence. There are some data that suggests that broccoli can be helpful as far as reducing the recurrence of bladder cancer. And there's a large study that's underway right now actually evaluating this. And just to kind of go a little bit into why broccoli, so it wouldn't be just broccoli, it would be other cruciferous vegetables. So things like cabbage and Brussels sprouts, and they contain a compound isothiocyanates, and those compounds are really great detoxifiers. So if you think about the bladder being a container for urine, urine often has the things that our kidney clears out as being, oh, we don't need this in our body. And so so if you think about consuming vegetables that help with the detoxification process, it does make sense that broccoli would be helpful. But just so you know that you don't have to eat that particular vegetable every day, there are other cruciferous vegetables that you can eat. We talk about some of those vegetables in the videos that Dr. Lee and Dr. Guiana and I made, and Dr. Gibbs. And then also there's some links on the BCAN website where we talk about some recipes that have cruciferous vegetables. So yeah.
Right. And they're very tasty recipes. So Morgan, can you show us the screen with the BCAN nutrition page? Because I want to find out if anybody has visited the BCAN nutrition page prior to this webinar. Certainly we're going to let you have that link so you can do that. And then, this is our nutrition page. It's pretty obviously nutrition. And so Morgan, can you just post the poll and see if anybody in the audience has actually accessed some of these videos? Okay. All right, just in the interest of time, I'm going to share the quick results. I think that you all have some homework to do. We have resources for you and tasty recipes. I know because I've made many of them and they're delicious. So I do recommend that you take a look at the BCAN nutrition page when you have a moment. And Morgan's going to drop that into the chat feature so that you have that. Okay, so great. Thank you so much for doing that. And I know we need to just do more to promote the nutrition page. And here's a couple of questions that are really important to me because I do like my coffee. There's two questions. My physician said drinking decaffeinated drinks is not great since it's then in the category of being processed. What are your thoughts? And also, there was a recent Mayo Clinic study that was published in JAMA Oncology saying that coffee, more than 1 cup a day, increased survival. What are your thoughts, and would this apply in bladder cancer?
All right, so the decaf question first. There are different ways to process decaf coffee. And I am not a specific connoisseur on this, but I will say that the more natural methods and extraction methods likely would not increase risk, or at least in my purview of processed foods and their concerns for cancer, I wouldn't have concerns. And then the question about coffee and survival. So what's interesting is coffee can help with getting sugar out of the bloodstream. So we were talking earlier about insulin and sugar. I mean, that might be one relationship. It's hard to, I mean, it's an association, but I don't have any data to say that coffee or the components within coffee that would actually decrease the risk of bladder cancer, but I wouldn't be concerned about drinking coffee and it increasing the risk. Let's put it that way.
Mm-hmm. And then if you threw in a little bit of the green tea with, no sugar, maybe a little natural honey, you'd be doing okay too. Okay, so you should kind of mix that up a little bit. All right, thank you. The next question I think is for Dr. Lee. I was just diagnosed with bladder cancer. They already operated on me. It was a superficial tumor, 1 centimeter, and of low malignancy. I want to know what I should and should not eat in general terms. Above all, I have doubts about what not to eat or drink: coffee, tea, hot peppers, oil, lemon, lime, a bunch of things that are in there. So you can both answer that question, Dr. Lee and Dr. Hamilton Reeves.
I was going to say what I would do in this situation is that I would call Dr. Hamilton Reeves and ask her opinion. So that's what I'm going to do right now.
That's great. So I think what's really tricky about these kinds of webinars is that I don't know Jose. So as far as what your foods are that you normally consume, I would say eat foods that taste good right now, and focus on vegetables. Watch some of the videos that we put out through BCAN that talk about some healthy recipes for for just increasing your health. Because I think the most important thing when you have a new cancer diagnosis is taking the opportunity to think about what changes you can make in your life right now to be healthier. And so, you know, Stephanie had mentioned physical activity and movement. I think it's not a bad time to start a walking program or start increasing what you do for activity, because that is another way to help make yourself stronger if you do have to face other treatments, and also just get your body more resilient and able to fight. And then, yeah, thinking about those videos, getting some recipe ideas. Fruits and vegetables are going to be some of the best things that you can have, some healthy proteins, some whole grains, and then ask if you can talk with a nutritionist at the place where you are diagnosed. Because again, we're going to start just promoting those conversations. Hopefully, again, the culture of the profession will change, but you can definitely ask for that. And then they can get to know you. And if you have any other health conditions that they need to personalize the diet for you.
And I just want to chime in. You know, we're talking, there's a lot of questions about specific vitamins or specific foods. The one thing that I want to reiterate to everybody out there is that if you're currently smoking still, that is, you know, instead of thinking about the one vitamin that you could take, quitting smoking is going to have more of an effect on your outcomes than any nutrition or supplement or anything like that. So that is obviously of utmost importance.
Yeah, and likewise,
And
some of the content that we made with BCAN already, rather than focusing on one vitamin or mineral, really thinking about what small changes can you make to get your diet higher in vegetables, higher in fruits, higher in whole grains. That's going to be much more effective for getting your body nice and strong.
So, and Morgan will drop in the link to the smoking cessation program that we did just a little while ago, so that in the chat feature, everybody who is a smoker who wants to look at that, they can do that, because that talks a lot about the impact of smoking on bladder cancer and the recurrence of bladder cancer. For a healthy, physically active, non-muscle invasive bladder cancer survivor, would you recommend a Mediterranean or keto diet to prevent cancer recurrence?
Yeah, so this person is asking about dietary patterns, which is really awesome. So there's evidence for both diets being good. I think I see the cue that you're physically active. A lot of people have a hard time following a true keto diet and keeping their activity and keeping their focus. And so I'm not saying that the keto diet is bad, but as far as sustainability, if you kind of check in with yourself and the foods that you kind of like to eat, I would think a Mediterranean diet is probably an easier pattern to follow. The Mediterranean diet is also associated with a lot of really great health benefits for other chronic conditions. And so that would probably, if I had to choose between the two, they're both fine. But if I had to choose one, I think Mediterranean. There's not a lot of data yet on on using a keto diet in bladder cancer to prevent recurrence. So, you know, I don't have data to guide me. I have more just gut instinct here.
Okay. Another question. What foods have high amounts of phosphorus, if you don't mind explaining that? And is there a link between high phosphorus diets and bladder cancer?
That's a good question to kind of stump me a little bit. So phosphorus is in like so many things. So when I work with patients that have chronic kidney disease, we oftentimes have to use phosphate inhibitors because it's in so many places. So thinking like meat products, dairy products are really high in phosphorus. Sodas, dark colas have high phosphates in them as well. Oh, look, it's Dr. Lee's cute kids. And I am not aware of a high phosphorus intake in bladder cancer increasing risk. Are you familiar with that, Dr. Lee? Have you seen that anywhere? I could ask Google, but it's not something that just comes to the top of my head as being a big risk factor.
Okay. So I know you guys mentioned in the video drinking more water, sparkling waters like bubbly, LaCroix. Are they good, or should you just stick to plain water?
I really like the carbonated waters. If people have issues with gas, I mean, that's probably the only major side effect. So if it's like right after surgery and you're all puffed up, that's probably not the best time to have carbonated beverages or drink from a straw, just because of the discomfort of the extra gas that you're introducing into your system. But other than that, I think they're delightful and a great alternative to soda. So yeah, I'm glad that you're experimenting with them.
Yeah. We've got a whole bunch more questions and not a lot more time, so I'm going to try to wrap this up in a little bit. Is there one thing I can add to my diet to have the biggest impact on keeping my bladder cancer away? Similarly, is there one thing I should eliminate to have the biggest impact on preventing a recurrence from cancer? I think that's a great question to end the program with. That's a good, strong one.
Well, that's a stumper because it's like asking me the question without the context. So I don't know what you're eating. So I can't tell you what the most offensive thing might be and what the healthiest thing would be. And so, you know, if I had to choose in thinking about bladder cancer and I would really focus on non-starchy vegetables. I think that's one thing when we've worked with our participants in research studies that have cancer, that they're like, I don't really like vegetables. And then they find out that they do. And then they're so surprised that the amount of vegetables we're talking about is like, one guy actually, he's kind of an exaggerator. He's like, it's like a truckload of vegetables. So, so I guess that would be the thing that I would add. As far as the thing that you eliminate, I am going to challenge the person that asked the question. I think, oh, it's Claire. Claire, I am guessing that you know the one thing to eliminate. Most people know what their one, like, you know, thing is. And so, yeah, I'm going to just reflect that one back on you and check in. Oh, look, she knew the answer. She responded. She said sugar and fat. And you know what, Claire, the food industry is designed to make us crave sugar, fat, and salt. Like our bodies are made to crave that. So that is nothing to take on as far as a shame or a guilt message. And yet you're right, sugar and fat, because they're used to make us eat more, a lot of times people in the US do eat a lot of them and too much. So you knew the answer. I knew you could do it. Thank you.
Mm-hmm. Well, again, you know, everybody's diet is so different because of their culture, but their region, the time of year. There's just so many factors. And, you know, whether you live in an environment that has a lot of fresh foods, or if you're in an environment where you have to get a lot of packaged things. So there's so many different nuances to try to understand, so many ingredients in this whole idea of understanding the food and the impact on cancer. But again, I think one of the biggest takeaways is ask your physician to make a recommendation to a oncology certified registered dietitian who can talk to you about what's unique and specific to what your needs are, because you might eat very differently. You might already be eating a very healthy diet, and it's just a matter of tweaking something or adding some fluids. So there's so many different nuances that getting that individual attention by a registered dietitian would be really beneficial, and I hope that everybody's able to do that.
Thank you for joining us for Enhancing Nutrition During Bladder Cancer Care, a patient insight webinar from the Bladder Cancer Advocacy Network.